favorite part of our pointer session, my expert opinion on what do you need to study for your exam. So let's begin. Okay. Now, here it is. The first one is Clostridium difficile. Remember, C. diff, in short, is a bacterial infection. Now, there are three common risk factors. Remember, PEP. One is prolonged hospitalization. 2E, elderly patient, meaning those who are above 65 years old are most at risk. And then the third one, you have prolonged antibiotics treatment. So in essence, those who are elderly on prolonged hospitalization and they are on prolonged antibiotics like a patient with COVID, then you are most at risk to Clostridium difficile. Now, how would you know that you have C. diff? The common symptom would be diarrhea that could be both watery and bloody. And of course, since this is a bacterial infection, your patient will have very high fever, then eventually they have loss of appetite, and because of the diarrhea, they lose a lot of weight. Now, what is the cornerstone of management in terms of preventing the spread of C. diff? Remember, the wearing of gloves is most important. Now, a patient in C. diff should be placed in which type of isolation precaution? That's going to be contact. So the use of gown and gloves is very important, but the cornerstone of prevention of spread would be the use or the wearing of gloves by both the healthcare workers, and the visitor should also wear your gown and your gloves when they visit the patient, especially if they're going to touch anything from the patient's room. Okay. Now, for mild cases, since Clostridium difficile is associated with prolonged treatment with antibiotics, what physicians would usually do sometimes for mild cases is that they stop the antibiotic that's causing it. However, your Clostridium difficile is best managed with vancomycin that's used for treatment. That's usually given every 6 hours. And of course, your metronidazole. So remember VM. Okay, vancomycin and metronidazole. Okay, now, next important thing that you have to remember would be your MMR vaccine. Now, this is given in 2 doses. The first dose is given at 12 to 15 months. The second dose between 4 to 6 years of age. What do I want to highlight regarding your MMR vaccine? Remember that some of the contraindications would include the following. One would be allergy to neomycin. Why? Because when they're preparing this vaccine, a small amount of the antibiotic is used in order to prevent contamination of the vaccine. So in which case, the vaccine has a component of your neomycin. So if the patient is allergic to antibiotics, chances are they could also be allergic to neomycin, which is used to prevent contamination of MMR vaccine. Now, your MMR vaccine could be made of live attenuated virus vaccine. That's why you have to administer it with caution in patients who are immunocompromised, meaning those who are having chemotherapy or steroid therapy. You have to clear it with the physician whether giving the vaccine is a better option. Now, for pregnant patients, has to be clarified too, and for those who are immunocompromised because of the presence of HIV infection. But don't forget, the most common contraindication would be allergy to neomycin. Next is your pediculosis, okay, or infestation with lice. Now, remember, what do you want to recall when you're taking the test related to this concept? How is it transmitted? The most common transmission is the sharing of hair accessories or hair articles that could include your hat, your scarves, even including your combs and towels. So therefore, it's very important that if you have towels which you think was used by somebody with pediculosis, you need to wash it in hot water, or you have to have it dried using hot air and then dry cleaned, or seal it in a plastic bag for 2 weeks. Okay, so since there is also a potential that the hair with the nits, okay, or the eggs of the lice could fall off the floor, so vacuuming the house could be appropriate, but there is no need to fumigate the house. So do not fumigate the house because that could potentially be toxic, especially if inhaled by people in the house. So Now, what type of isolation precautions do we need to implement? Contact precautions, which means the gown and the use of gloves will be required, and this is strictly monitored until 24 hours after initial treatment with medications. Now, all contacts and all household members must be treated with your permethrin lotion. This is very, very important in order to kill the nits. Now, take note that your Quell shampoo that is used to be given to the patient um, has been identified as neurotoxic, and it has been found that these are not considered pediculocide anymore. So which simply means this could just be alternative treatments. So the main treatment would be the use of your permethrin lotion and the use of fine tooth comb after. Now, there's also another solution that could potentially kill the lice, for example, benzyl alcohol, okay, which kills the lice by asphyxiation, not through other means. And then, of course, ivermectin lotion could also be used. Now, take note that your fluorine does not kill the head lice. However, find comfort in the fact that your pediculosis is also not transmitted through swimming, okay? So it's not a guarantee that if your swimming pool is chlorinated, then you will not have pediculosis. If you're using the same towels as the other people who are swimming, then there's a great chance that you could also have it. Now, how would you know that the patient has pediculosis? Well, okay, observe for ISSI, meaning itching, scratching, sores in the head because of continuous scratching, and irritability because they lack sleep because they always scratch their head. Now, this is a very, very important observation. Okay, so the symptom could eventually become behavioral because of the lack of sleep of the person. So those are the things that I'd like to highlight. Don't forget the second important thing, study using technology. Remember, at the Ray Gapuz system, our tools are world class. And of course, our latest technology tool, you have the Ray Gapuz course shells that covers all the subjects on the NCLEX. So please give us a call to find out how you can qualify to access this for free. Okay? So, and the third, you have to be in a conducive environment. It should keep your sense of focus. This is our AA Gapuz NCLEX simulation room located the second floor of the Ray Gapuz building here in UN Avenue. And this is how intimate and comfortable our class is. Okay, so may I invite you to avail of our next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. Your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, your QBank and 3 books, and the NGN strategies and sample questions by me. Okay, plus you'll see me again in our quick fix session. That's a 24-hour session, 8 hours per day. Okay, so you have a total of 3 days. And the fee starts at 3,499. So we have available schedules, weekdays, both in the morning and or in the afternoon. Weekend classes, that's going to be whole day classes on a Saturday and Sunday. Give us a call at 0906-201-9383 or send us a message at our email info@ragapuzreview.com. So once again, this is your mentor, your fact check buddy Ray Gapuz, saying thank you for joining me today, and I'll see you back in my next video for more of our NCLEX NGN pointers. The first one is, what are the things that I have to focus on when you're preparing for the next generation NCLEX for this specific time of the year? So let's begin. And this is about the Holter monitor. Now remember, a Holter monitor is a tape recording of a client's EKG for 24 hours. Now usually, this is worn by the patient for 24 hours, but the installation of this is very, very quick. So less than 10 to 15 minutes. The only requirement for the patient is actually to wear a shirt that has buttons in front, and then instructions for the patient who is wearing a Holter monitor would be highlighting several important things. One would be that they cannot, remember, they cannot take a bath while the Holter monitor is in place. But they can always go to work or to visit friends, go driving if they don't have fainting or dizziness. That's perfect. However, they also need to avoid exposure to a magnetic field, microwave oven, and of course, electric razors and toothbrush, okay, including metal detectors. Now, there are several things that you have to tell your patient because your Holter monitor usually comes with a log-on notebook or a diary in which the patient will be writing down or paying particular attention to the symptoms that they feel, and they have to make sure that those are properly logged in the notes. And then instruct the patient also to press the event button just in case they feel some manifestations that make them uncomfortable, okay? So the only requirement is for the client to wear loose clothing with buttons in front. That's the only requirement for the use of a Holter monitor. It's non-invasive, okay? Next would be your stage 2 pressure injury. And if you talk about stage 2 pressure injury, it's the pressure injury that affects the top area of the skin and usually requires pay particular attention to the dressing, a thin hydrocolloid dressing. And primarily the purpose of that dressing is to decrease shearing force, okay, on the skin, okay? So that would definitely decrease the friction on the skin. So if your patient is having stage 2 pressure injury, what are the things that we need to assess? Is there an open wound? Is there swelling? Is there skin discoloration? And is there pain? Now, if you're going to take the next generation NCLEX, focus on potential SATA or select all that apply items or multiple choice with multiple response item. Like, what are the body parts in which your stage 2 pressure injury could be common? And that includes your bony areas, like, for example, the elbows, the knees, the tailbones, the ankles, the heels, okay? So these are the areas in the body that you have to focus on. Now, your pressure to injury is usually common when you have immobilized patients or those who are on prolonged bed rest. And there are 3 things that you have to focus on. Remember, P-U-S, okay? P is their pain. And then U, how do you characterize the ulcer? Does it have any drainage or pus or clear liquid? And then S, swelling and shallow crater or blister. So if you see blister formation, that's stage 2. If you see shallow crater-like wound, that's stage 2. Now, pay particular attention to the treatment for stage 2 pressure ulcer. One could be dietary modification. The diet should be high in protein and high in calorie. Then it has to be supplemented with zinc and of course your arginine, which is a type of amino acid. And of course, if needed, the doctor will prescribe antibiotics. Now, focus primarily on the type of dressing that needed to be used. And that's going to be your hydrocolloid dressing, okay? The purpose is to decrease shearing force or to decrease friction. Now, the third topic that I'd like to highlight at this point would be your blood transfusion. Take note that for a patient to undergo blood transfusion, they will first have to have their compatibility testing, which means there should be identification of the blood type of the patient, and secondly, there should be identification of the RH status of the patient. So RH, or the rhesus factor, is an inherited protein found in the surface of the red blood cells. Now take note, 85% of people are RH positive. The RH positive gene therefore is considered as dominant, and usually the father can pass down his RH positive blood to the baby. Now, what seems to be the problem in RH incompatibility? Remember, okay, so in ABO incompatibility, the destruction of the RBCs could result from the inappropriate administration of blood to a patient with a specific blood type. So for you to remember this, a patient with blood type A can be given blood type A and O. A patient with blood type B can receive blood type B or O. A patient with blood type AB can receive either blood type A, B, AB, or O. And a patient with blood type O can receive blood type O only. Okay, now let's integrate the RH status of the patient. Remember this functional concept. A patient with an RH positive blood can receive both RH positive and negative blood, whereas an RH negative blood, if that is present in the patient, will make that patient only compatible with a blood supplement that's also RH negative. In other words, okay, if the patient is RH negative blood, the blood RH status that's compatible with his or her blood should only be RH negative. So the problem is, like for example, in RH incompatibility, if the mother is RH negative and then the husband is RH positive and the husband has passed down the RH status to the baby now is RH positive. So after the delivery of the first baby, next pregnancies could predispose that patient to RH incompatibility when the RH status of the mother is negative and that of the baby is positive. That's why a PUMS test is usually done and ROGAM is usually administered within 72 hours after the delivery of an RH positive baby from an RH negative mother. Okay, now, to lessen your confusion, let's try to arrange this concept and simplify as we've used both the concepts of ABO compatibilities and RH compatibilities. Therefore, what did we say? An RH positive blood can be mixed with both positive and negative blood. So therefore, a patient with blood type A positive can be given A positive and negative or O positive and negative blood. Okay, focus on blood type B positive. So if the patient has a blood type B positive, the patient can be given B positive and negative, O positive and negative blood. If the patient has AB positive blood, the patient can be given A positive and negative, B positive and negative, AB positive and negative, and O positive and negative. In other words, the patient with blood type AB is the universal recipient, whereas a patient with blood type O positive can only receive blood type O positive and O negative. Okay, let's take a look at the other way around. What if the patient has an RH negative blood? So a patient with a blood type A, RH negative, can only receive A negative and O negative. Blood type B negative, the patient can only receive B negative and O negative. Blood type AB negative, the patient can only receive A negative, B negative, AB negative, O negative. And if the patient has blood type O negative, patient can only be given O negative only. Okay? So if you have difficulty remembering these concepts, all you have to do is to rewatch this video again so you can master it. Okay? So the second important thing is study with the right technology. And at this point here at the Gapuz system, we have publications of our learning tools by internationally renowned publishing companies. And of course, the latest tool that we have, you have your Gapuz review system for Shell that covers all the subjects on the NCLEX. You can access this anytime, anywhere. And this comes with unlimited access for a very minimal fee of $149 only. Okay? So if you want to access this for free, all you have to do is to call our office. Okay, and of course, the third and most important element would be your conducive room environment. This is our simulation room for the nclex-pn, where our students learn um, real life experience of navigating through next generation items using our software. And of course, this is our very intimate class size. You can join us anytime. We do classes monthly, and I'd like to invite you for our next generation NCLEX-RN Flex, the most flexible test prep class for the NCLEX-RN. The fee starts at $3,499. You can have a morning class and afternoon class for this exclusively weekend classes, okay? So this is NCLEX-RN Flex because it's your choice whether you want to attend live face-to-face class, live virtual class, on-demand and limited video recording sessions or lessons, and you get an access to our QBank plus our 3 books, NGN Strategies by me, and of course your quick fix session, which is a 24 hours conducted in 3 days by me. Okay, so take that opportunity to pass NCLEX-RN, the next generation set of questions with Dr. Gapuz, of course, through our Ray A. Gapuz review system. So once again, this is your mentor, your fact check buddy Ray Gapuz, saying thank you and see you in our next video. Take care, and remember, a functional concept a day keeps your NCLEX-RN fears away. Now, the first thing that you have to ask yourself when you are preparing for the next generation NCLEX is, what should I study? The key is having a sense of focus. You don't study everything that you took up in your Bachelor of Science in Nursing degree. That will not help. That's a sure recipe for failure. Now, to streamline the things that you want, that you should study rather, here are the topics that I'd like to highlight. First and foremost, the preschool client. Now, remember this functional concept. Preschool clients have fear of body mutilation, so which simply means they don't want to see themselves bleeding. So to encourage their cooperation to any procedure that you're preparing them to or preparing them for, focus on having a standby band-aid. Just in case that bleeding may occur, then you can actually immediately stop it. And of course, if the patient would ask, will it be painful? You have to be honest, but make sure you don't use the word pain, because anticipation of pain increases their pain experience, okay, in terms of severity. Therefore, use the word pressure instead. So tell the child you will have a sense of pressure during the procedure. And then, if it's possible, you can involve the parents. If the child will have catheter insertion and the parents, for example, are healthcare workers, you can involve them in inserting the catheter for the child. You can use play, demonstrate using dolls, allow the child to touch the demonstration tools that you prepared for the procedure, and then before touching the child, ask permission that you're going to touch them. And then definitely, after they have cooperated, you will need to give them specific praise. And if they need to carry out procedures like positioning themselves, offer suggestions but not command, and provide them with choices while maintaining the rules. For example, okay, if the discharge instruction would entail that the patient, meaning the preschool client, would need to brush the teeth regularly because they have been given anticonvulsants. So ask the client, would you want to brush your teeth before watching your favorite TV show or after you watch it? So the choice should always lead to their complying with the rules or the discharge instruction. Like if they will have injections, you would need to ask them, would you want it on your shoulder or on your butt? So the end point would definitely be that they will have the injections anyway. Or if you are going to give them oral medications, you will need to ask them, would you want to take your medications with water or with milk if it's not contraindicated. Okay, that's the way to obtain the preschooler's cooperation. Next, hyperkalemia. Now, notice when you speak of hyperkalemia, think about peak T waves. To remind you of the peak T waves, tall peak T waves, remember about the Eiffel Tower, okay? That's the Eiffel Tower shape of T wave that you have there. And notice that in hyperkalemia, you have widened QRS. The normal is 0.08 to 0.10, meaning to say 2 to 2.5 small squares, okay? This one is more than 2 to 2.5 small squares. So that's a widened QRS complex. And then the distance from the P to the R interval should only be a maximum of 1 large square or 3 to 5 small squares. However, for this patient, you have more than 1 large squares or more than 5 small squares because you have 5 small squares in 1 large squares on your ECG paper. So this simply means that there is a prolonged PR interval. So the three things, tall peak T wave, widened QRS, and prolonged PR interval, these three things define hyperkalemia, okay? Now, take note. What treatment medications do you expect? Remember, CIA. The first line of treatment would be your calcium gluconate. That's given to protect the cardiac cells from hyperactivity. Second would be insulin and glucose combination. What's the purpose of insulin in a patient with hyperkalemia? Insulin will facilitate the entry of potassium from the blood into the cells, thereby decreasing potassium levels in the blood. And of course, your albuterol, which I know is something that's more likely identified with patients with asthma because it's a bronchodilator. However, your albuterol would enhance the effects of your insulin and glucose combination. So in essence, your albuterol helps lower potassium levels. But take note, your albuterol can potentially cause can potentially cause, pay particular attention to this, palpitation or increase in the patient's heart rate. So in essence, the priority intervention, if your patient who is taking albuterol, okay, in your patient who's taking albuterol would be monitoring the heart rate. There you go. That's one thing that I'm trying to think about when I'm highlighting your albuterol. So once again, in hyperkalemia, CIA, okay? So your calcium gluconate, insulin plus glucose plus albuterol. All of these will help decrease the potassium levels of the patient. So once again, monitor the patient's heart rate so there could be an increase in the pulse of the patient. Okay, so let's move on. Hyperkalemia is characterized by, remember, to summarize it, here's a functional concept. Tall peak T wave, widened QRS complex, and prolonged PR interval. Okay, now let's talk about toys for infants. Here's a guideline through a functional concept. Infants should be provided with toys that stimulate the senses. When you say toys that stimulate the senses, this could be toys that stimulates the sense of touch, like soft dolls, toys that stimulates the vision of the patient, like colorful books, toys that stimulate the hearing of the patient, like a mobile or any toy that makes sound, like for example, a plastic or a rubber duck that squeaks, okay? And then toys that can be moved. Take note, older infants from the 7 months onwards would love to move certain things. So toys that can be moved include large soft blocks that they can manipulate, large beads could be allowed for infants, and nesting toys. Now, an example of nesting toys would be dolls of different sizes in which you can put the smaller doll into the bigger doll, like the Russian dolls, okay? So, which simply means these are called nesting toys. This will help enhance fine motor skills of the infant or the baby. And of course, the second important thing that you have to remember when you're taking the next generation nclex-pn is that studying with the use of technology. You have to learn how to navigate the questions using technology. Do not use just paper-based tests. No, the next generation NCLEX will require you to navigate through the different types of questions, okay? So here at the Ray Gapuz system, our learning tools are published by renowned international publishers, and our latest learning tool includes the Ray A. Gapuz system core shells. Now, to avail of this for free, give us a call or send us a message. And of course, we will raffle off free access to our core shells on June 25. So register for our event. And of course, the third and the most important thing that you have to focus on when you're preparing for next generation NCLEX should be a conducive environment. Here at the Gapuz system, we have our own NCLEX-RN simulation room where our students learn how to navigate through the different types of questions and, of course, our very, very intimate face-to-face classes during our quick fix sessions. Okay? So, may I invite you to join us for our next generation NCLEX-RN Flex, the most flexible test prep class for the NCLEX-RN. The fee starts at $3,499. You can choose to have your schedules on weekdays, either AM only or PM only, or full day classes on weekends, or half-day classes on weekends. You may actually give us a call at mobile number 0906-201-9383. Now, NCLEX-RN Flex is designed to cater to working nurses, so you can have a choice of live face-to-face classes, live virtual class, on-demand, unlimited video recorded lessons, QBank plus our 3 books, our NGN strategies and sample questions, and of course, 24 hours quick fix session. So, this is your mentor, your fact check buddy, Gapuz, saying thank you for joining me in this session until our next session. Remember, a functional concept a day keeps your NCLEX-RN fears away. What will I study? Make sure you're getting the topics that you need to focus on from someone who is an expert, not the false prophets of the NCLEX, NGN type questions. Okay? There are a lot of false prophets out there. Here, our system is based on empirical and research methods. Okay? So here we go. So the first topic that I'd like to highlight would be dehydration. And when you study the concept of dehydration, make sure that you have to compare who should be your priority. Is it a dehydrated 80-year-old or a dehydrated 8-month-old? Here's the answer to that question, okay? Remember, IV fluids help maintain body fluid balance, and the average daily fluid intake in an adult is 1,500 to 1,700 ml. Obtaining the body weight is the most objective way of monitoring body fluids. And take note, here we go, dehydration is more severe in young patients. Why? Because their body weight is more dependent on more fluids than the adults. So which means the percentage of water in the human body decreases with age. Look at this. The fetus, their body weight is dependent 100% on water. The baby at birth, 80% of the body weight is dependent on water. Normal adult, 70% of the body weight depends on water. And in the elderly, 50% of their body weight depends on water. So therefore, if you're comparing dehydration in a baby and dehydration in an elderly, it is more harmful in the baby because the baby's body weight depends more, approximately 80% of water in the body than that of the elderly, in which the body weight depends on the 50% amount of water in their body. So dehydration will have more severe effects in the infant than the elderly, okay? So the characteristics of the skin depends on the degree of dehydration. If less than 5%, there's going to be 5% loss. The skin will be pale. Then it's one to touch. For 10% loss, very pale to cool, and then mottled. For 15% fluid loss, mottled to cyanotic and cool. Now take note that in the first 2 weeks after birth, the baby would usually lose normally 10% of their body weight, and they will have to regain it within the next 2 weeks. So at approximately 1 month after birth, their body weight is the same as their birth weight. Okay, now allergy. I'd like to focus on latex allergy. Who are more at risk to latex allergy? Clients with multiple surgeries, like clients who have undergone surgeries 5, 6, 7, or 8 times. Healthcare providers because of frequent exposure to latex. Okay, babies with spina bifida or meningocele or myelomeningocele, because these babies would have to undergo multiple surgeries as they grow up. Because more often than not, myelomeningocele after the closure could potentially lead to hydrocephalus. And after hydrocephalus, usually they will need to be um, operated on for the insertion of ventricular peritoneal shunt. So that will make them more at risk to latex exposure in the future. Family history, and then of course, multiple exposure to latex. Now, what are the different elements that a client with latex allergy should avoid? Okay, clients with latex allergy should avoid avocado, banana, balloons, chestnuts, chewing gums, condoms, not unless it's your condoms or chewing gums, kiwi fruit, pacifiers, pineapple, and of course strawberries. Now, pay particular attention to the fact that dragon fruit is usually not associated with latex allergy. It has a different allergic reaction, not necessarily related to latex. Okay? And of course, the third topic would be digoxin overdose. Now remember, the first line of treatment for digoxin toxicity is repeated dosing of activated charcoal to decrease the absorption. It's usually best given within the first 6 to 8 hours after ingestion. In acute digoxin toxicity, Digibind is given as follows. Initial 5 vials of hemodynamically stable clients for hemodynamically stable clients, but 10 vials if the client is unstable. And then repeat doses of 5 ampules every 30 minutes until the reversal of digoxin toxicity is achieved. Now, usually, what causes digoxin toxicity? If the patient forgets about the dosing, for example, if the patient's dose could be half tablet before bedtime, and then the patient, instead of taking half tablet, took 1 whole tablet. So you will have to first assess the patient. The common manifestation of digoxin toxicity should be unstable pulse rate that usually goes down below 60, and then there's going to be persistent anorexia, nausea, and vomiting. In that case, instruct the patient not to take additional dose of the medication and consult with the physician right away. So that's the most important thing if the patient has taken double than that of the dose that has been ordered by the physician. Okay, so the second important thing is use technology to study the next generation. NCLEX is difficult to navigate if you are not familiar how to navigate the technology enhanced interface of the examination. So here at RA Gapuz, we have tools that have been published by world-class publishers. And of course, we have learning tools that addresses the different subjects on the NCLEX-RN. So pay particular attention to the fact that we're now offering the RA Gapuz Review System course shells. And for you to find out how you can avail this for free, send us a message through email or through our text line. And wait for the grand raffle for the free access to our learning tools on June 25. Register early. And of course, the most important thing when you are preparing for the test is you have to be in a conducive environment that should keep your focus. Here at the RA Gapuz system, the second floor of the RA Gapuz building in UN Avenue, we have our NCLEX simulation room that simulates the entire NCLEX-RN experience, and of course, our very conducive face-to-face classes during quick fix sessions. So join us, send us a message, and I'll see you in our next video. But before we end this session, may I invite you to join me in the next generation NCLEX-RN Flex, the most flexible test prep class for the NCLEX-RN. The fee starts at $3,499. You can choose to have either weekday classes, either AM only or PM only, or weekend classes, also either AM only or PM only. Give us a call at 0906-201-9383. So the NCLEX-RN Flex has several components, like you can choose live face-to-face class, live virtual classes, on-demand unlimited video recorded lessons, QBank, and 3 books, or next generation strategies and sample questions with me, okay? And of course, quick fix sessions, okay? So I'll see you in our next video. Once again, this is your mentor, your fact check buddy Ray Gapuz saying, a functional concept a day keeps your NClex-RN fears away. Take care. Have to ask yourself is, what will I study for the test? Make sure you are asking from an expert who knows the test content. Well, it helps that you're asking friends who passed the test, but please don't ask the exact question. Ask the concepts and then study it. Because the recall of the question of your friend is based on their own interpretation, not based on the data that you're supposed to interpret by yourself. Okay, so here are the things that I'd like to highlight at this point. First, you have your ventricular fibrillation. Notice the chaotic ECG reading in ventricular fibrillation. Now take note that ventricular fibrillation is the most dangerous type of arrhythmia, and this can lead to asystole. So therefore, this is life-threatening, this is fatal. So if you're being asked to prioritize which client will you attend to first, then attend to the patient with ventricular fibrillation if the patient is in the emergency room, because by that time, you already have the equipment, the facility, and the human resources to attend to the patient's needs. Okay, how will you know that the patient's having ventricular fibrillation? Usually, you observe for 3 things: FSC, fainting, shortness of breath, and then cardiac arrest. And then check on the ECG tracing. There will be no pulse, there will be no P wave, there will be no QRS complexes. The ECG waves would be very, very chaotic. So therefore, what could have brought this? What can potentially lead to ventricular fibrillation? That's going to be heart attack, hypokalemia that could be secondary to the administration of diuretics, and of course, genetic diseases, like for example, prolonged QT syndrome, that could be associated with hypocalcemia. Or the patient could be having Brugada syndrome, in which there's arrhythmia that leads to cardiac arrest. Okay? Now, pay particular attention to the fact that the first response for defibrillation is CPR. Sorry, the first response for ventricular fibrillation is CPR, and that's followed by your defibrillation. Now, there are several drugs that are given to the patient to restore normal heart rhythm, and you have 3: VEA, vasopressin, epinephrine, and amiodarone. Now, amiodarone is usually the drug of choice. However, the alternative drug could be lidocaine. So your vasopressin, epinephrine, amiodarone usually be given in ventricular fibrillation to restore normal heart rhythm. So once again, focus on monitoring the ECG tracing and the heart rate of the patient. Okay, now we have your allopurinol or Xyloprin. Now this drug is used in the treatment of gouty arthritis. It's best taken after meals and usually with water. Now, what are the common side effects? Well, the patient would usually complain of nausea and vomiting. However, what are the adverse effects that you will need to report to the physician? Now, this includes the yellowing of the whites of the eye. So this is known as jaundice. That could be related to hepatotoxicity. And then, if the patient would have high fever or high temperature plus sore throat, suspect a granulocytosis, that's a medical emergency. You need to refer to the physician immediately. And if the patient is brushing the teeth and all of a sudden there's bleeding gums, so that could be associated with bleeding adverse effects associated with the intake of the drug. So you need to refer to the physician, describe how the bleeding occurred. And then, since your allopurinol could potentially cause or trigger diabetes mellitus, the patient may be experiencing polyuria or frequent urination. So they frequently visit the comfort room. And most importantly, if the patient suffers from flu-like symptoms, plus the development of rash that could eventually lead to blindness. This is what we call Stevens-Johnson syndrome. Now, this rash-related condition could also be present if the patient is taking anticonvulsants for a prolonged period of time. Okay, so those are the things that you need to remember related to the drug allopurinol or xylopin. Remember, take it after meals and with water. Next, remember, allopurinol is used to treat gout. And then, of course, you have your sodium nitroprusside or nitroprusside. It's a vasodilator. So this medication is used to treat acute hypertension. And remember, it's only administered through IV infusion. It's usually given diluted in D5 water. And the most important thing that the nurse should remember, you always need to protect it from light all the time. It should not be given if the patient has vitamin B12 deficiency, because your sodium nitroprusside will affect the absorption of vitamin B12. So it will further make the situation worse. Okay? So what are the common side effects? Remember your MBSH. So nausea, vomiting, skin rash, and then headache. Okay? Those are the common side effects. However, what are the adverse effects that you will need to refer to the physician? Focus on the heart rate. So the heart rate could go up or down. So it could be unstable heart rate for the patient. And then, since this is a vasodilator, it could potentially cause severe hypotension. So your priority vital signs would be the two important things, the pulse rate and then the blood pressure. Then the patient could have shortness of breath, chest pain, and decreased platelet aggregation, which simply means the medication can potentially cause bleeding. Okay? So once again, if you're preparing for the next generation NCLEX, prepare with a technologically enhanced learning environment, which simply means it's not enough that you're using paper-based materials. You have to learn how to navigate through the next generation type of questions. And here at RA Gapuz, our learning tools are published by world-renowned publishing firms. And of course, our latest product, please give us a call or text or an email to inquire how you can avail of the Ray Gapuz course shells for free and join our event on June 25 from 8 to 12 noon. I'm giving away free next generation NCLEX review session with free materials, plus we will raffle 15 free access to our course shells. Okay, so the third and most important component of preparing for the next gen NCLEX is you have to be in a conducive environment. Here at the second floor of the Ray A. Gapuz building in UN Avenue, we have our own NCLEX simulation room where our students can navigate through the different next generation NCLEX type of questions and experience real life procedures that simulates the NCLEX. And of course, our very intimate classes that are conducted face-to-face monthly. So may I invite you to join our next generation NCLEX-RN Flex, the most flexible test prep class for the NCLEX-RN. The fee starts at $3,499. Give us a call at 0906-201-9383. Your choice of live face-to-face class, virtual class, on-demand and limited video recorded lessons, our Cuba plus our 3 books, next generation strategies and sample questions, and of course, the quick fix sessions that you will have with me. It's a total of 24 hours conducted in 3 days. So once again, this is your mentor, your fact check buddy Ray Gapuz, saying a functional concept a day turns your NCLEX-RN fears away. See you in our next video.